Here are 9 causes of a faster heartbeat. Heartbeat or abnormal heart rate shows the state of the heart in the body. Ignorance of it and treatment can occasionally be fatal. Conditions whereby the heart rate falls below 60 beats per minute or surpasses 120 to 140 beats per minute might be fatal. This video will go over items you might typically eat as the reason for a faster than normal heart rate. Let's start with heart rate. Heart rate, sometimes known as pulse, is the number of times your heart beats in 1 minute. Typical resting heart rates for adults fall between 60 and 100 beats per minute. Usually resting lowers. A lower heart rate at rest indicates more effective heart function and improved cardiovascular fitness. People occasionally find that their heart races when they lie down, particularly at night, when they are more active. You're relaxing. Why then is your heart racing? Let's dissect it so we may fully explore this intriguing subject. Number 1, we talk about body position and blood flow. The alteration in body posture is one reason this occurs. Lying down causes blood usually to pool in the lower half of your body due to gravity and begin to move more freely towards your chest and heart. This boosts the blood flow returning to the heart. Your heart might so momentarily pump faster or harder to adjust for the unexpected change in blood flow. Although this is usually very transient, it can cause a clear rise in heart rate momentarily. Usually, though, this impact is fleeting. Your heart rate should settle. Next, number 2. Stress and anxiety. Anxiety or worry is another major reason you could find your heart pounding when you lie down. Even at rest, anxiety and stress can dramatically affect your heart rate. Lying down, especially at night, the peaceful surroundings can cause more brain activity since they provide less distractions. If you're nervous, your body could release stress hormones like adrenaline, which can speed up the heart. Even in absence of immediate threat, this reaction is a component of the body's fight or flight response. Number 3 is palpitations night. Have you ever found yourself lying down experiencing heart palpitations? That sensation whereby your heart is pumping either quicker or slower than usual. This can occur since, in relaxation, your awareness of your pulse increases. You could not see it as much throughout the day as there is so much noise and distraction involved. But when you lie in bed in a quiet environment, those beats could seem more strong. This is usually benign, but if it occurs often it's wise to see a doctor to be sure. Number 4. Food, caffeine, and stimulants. Even at rest, stimulants such as caffeine or nicotine can raise your heart rate. Adrenaline, which stimulants release, causes your heart to speed up. Lying down can help you to see this effect since you are more tuned in to how your body feels free from outside distractions. Number 5. Large meals and digestion. Your body redirects extra blood to the stomach and intestines to aid digestion after a big dinner. This process increases the effort exerted by your heart, causing your heart rate to speed up. If you lie down after eating, which should be avoided, the horizontal position can further affect blood flow, making a higher heart rate more apparent. A faster heartbeat can also be triggered by certain foods or dietary patterns, especially those containing spices or fats. Number 6. Medication list. Some drugs, including those prescribed for thyroid problems, depression, or asthma, can change heart rate. Beta agonists, for instance, used in asthma, can boost your pulse rate and accelerate the heart. One negative effect of these drugs could be racing of the heart if you are lying down. Number 7. Dehydration. Because less fluid in the body makes it more difficult to sustain appropriate blood pressure and circulation, dehydration can lead the heart to work harder. Lying down, particularly if you're dehydrated, your body responds by raising your heart rate to better pump blood. Jump to number 8. POTS, postural orthostatic tachycardia syndrome. POTS is the disorder in which the autonomic nervous system fails to correctly control blood flow, leading to notable variations in heart rate with position change. Although POTS symptoms usually show more when standing, some people may also have heart rate increases when lying down because of improperly controlled blood flow. Lastly, number 9. Apnea during sleep. Because of small pauses in breathing during sleep, those with sleep apnea may suddenly feel as though their heart rate is rising when lying down. These pauses produce a brief dip in oxygen levels, which the body uses to compensate for, which causes a higher heart rate. To put it another way, your heart might race when you lie down for a number of reasons, from changes in blood flow to worry, digestion, even stimulants. It's not usually something to worry about most of the time. As always, though, pay attention to your body. If something seems weird, it's usually wise to have it looked out. I really appreciate you seeing. Should you find this video useful, give it a thumbs up and remember to subscribe for other health and wellness material. And leave any questions or personal experiences you have related to this topic in the comments below.